O'clock, and welcome to the big story. So, the administrative block at the Cornwall Regional Hospital, the CRH, is being renovated and upgraded to improve efficiency and productivity. The block, we understand, will feature modernized office spaces, improved ventilation and lighting, also upgraded IT infrastructure, and enhanced accessibility. The office will house some 22 team members, including the Office of the CEO, and will support medical staff and administrative services. And that is only one of the blocks that's being worked on down there inside of Montego Bay at the Cornwall Regional Hospital. There's a whole lot more going on, and so we're very pleased at this time to be joined by our Minister of Health, Dr. Christopher Tufton. Good morning, Dr. Tufton. How are you doing today?
Hi, Richie. Not too bad. How are you?
I am doing well, and it's always a pleasure to have you on the program. What can you tell us about what's going on? It seems like there is a gradual reopening of the Cornwall Regional Hospital. Is that correct, Doctor?
Right. So we're engaged, as we had announced previously, into the phased reopening of the main building. Cornwall Regional, as a service provider of health services, has always been there and continued to be there over the years, despite the shutting down of the main building due to maintenance issues and air quality issues. We are now in a position on the final phase, if you will, and yesterday what we witnessed was a kind of glimpse into what the new Cornwall will look like. Very modern, ultra-modern in terms of its layout, in terms of its functionality, in terms of the spacing, and the team who have re-engaged, the administrative team, are very happy. And so it was a good day, and it showed what will be coming later on as we seek over the next number of months to continue to just phase the re-engagement, the full re-engagement of the building.
You did not say number of years, you said number of months. Is there a target in terms of when you might get to completion?
So we're hoping that we will continue the phase reopening into the end of this year, into early next, and the full re-engagement based on the timelines with the contractor for first quarter of next year.
Mm-hmm. What specific benefits, Dr. Tufton, do you expect the enhanced accessibility and so on, those features to bring to both staff and to visitors alike?
Well, in the case of the administrative wing, the team had to be located off-site up to this point during the last number of years. So if they had to move to site where we were providing services, because we still built out a number of services around on the compound around the main building, even though we vacated the main building, they would be managing remotely almost by having an office in another location, traveling to the main site based on what was required of them. What we have now is for them to be concentrated on site, and so they are now back where they were and ought to be in terms of providing hands-on management for the facility. So from that perspective alone, it's a major positive. The fact that they're going into a much nicer facility than they left is also very important for productivity and patient care. So it's a good thing from a utility perspective. And then, of course, generally speaking, it gives a kind of look at what the new Cornwall will be. So hopefully for those waiting for their turn, there's a lot of hope and excitement and anticipation, and deservedly so.
Yes, I did see a lot of excitement, especially from staff members yesterday in a news clip that I watched last night. I hear figures of $23.5 billion being bandied about as the investment in the Cornwall Regional Hospital rehab project.
Right.
Can you sort of say how this is broken down, Doc?
Right, sure. So first of all, we haven't spent that amount of money as yet. We've spent $3.9 billion on the main building, and that involves stripping the building down totally, meaning all the floors, all the ward space, all the windows and doors, reinforcing the walls that were compromised in some areas, putting on a new roof, and now rebuilding, as we have done with the administrative wing, to re-engage. Another $1.8 billion has been spent relocating services, because the main building had nearly 400 beds and several services. We had to relocate those services in order to get access to the main building to do the repairs. So The Mount Salem Clinic on site had to be converted to A&E and double the capacity. We had to build a new diagnostic center. We had to convert the nurses' quarters into inpatient care. We had to build out 2 operating theaters at Falmouth to do electives, and so on. So a part of that expenditure to date would have been facilitating infrastructure outside of the main building, the other part on the main building. And then in terms of the rest of the spend, it will include things like all new equipment, $3.5 billion. So every piece of equipment, the CT scan, the MRIs, the digital x-rays will be new, and provisions are being made to purchase those. And it will involve also GCT taxes, about $3 billion. So when all things are factored and a comparison is made with any similar hospital that is being built out, for all intents and purposes, a new hospital, the cost per square footage is quite competitive based on what the consultants tell me. And we believe that the people and the value that they get from the services will be well worth it when it is all finished.
Okay, because there are 2 things that spring to people's mind when they think of what's been happening at the Cornwall Regional. One is the fact that we've waited for quite some time to even get to this stage of partial reopening, and also the fact that you've had to readjust, I think, over time, the budget. So you're saying that when all is considered, it will be well worth the wait, so to speak, Doc? Yeah,
well, 2 things I say about the budget. First of all, when we started on this journey as a new government back then, the idea was to fix what we perceived at the time as the problem, which was a ventilation problem. That's what others have been doing since 2009 when the ventilation issues became apparent, because it started well before our time. It eventually morphed into several other problems once we started to dig deeper. Leaking pipes in the walls, corroded electrics, compromised foundation of the building, etc., etc. And so what the government did in their wisdom is to say, let us do a comprehensive assessment of the state of the facility and literally rebuild the hospital. It was then a 50-year-old plant, so it has used its useful life. That's about the life cycle of a building. And with poor maintenance, it could be a lot shorter. So the government took the decision to rescope, hence the adjustments in cost. And we believe, again, that it is better to just fix the problem once and for all than to be going back every year or every month trying to place a Band-Aid approach on it, which is what has been happening in the past. So we believe it's the right decision. And again, based on what we saw yesterday and what is to come, which includes added facilities like 4 additional operating theaters, twice the size for the A&E, and so on, that the people of Western Jamaica who use the facility will see the wisdom and the benefits of what we have had to do in terms of the rescoping.
In a nutshell, Doc, what is the overall vision for the Cornwall Regional Hospital's development?
So the campus of Cornwall Regional is now more than just Cornwall Regional Hospital. It has a 250-bed new facility being built, finished again within a year or 2, called the Western Child and Adolescent Hospital. And that is almost complete. So you have 2 towers there. The vision is to have the highest concentration of hospital beds in the Caribbean, over 800 beds, 15 new operating theaters, a range of specialist services, and it will accommodate staff in some instances. There will be some accommodation there. So what we are creating is a modern facility, because within that year, what you are going to have are 2 new facilities. It will accommodate training, so it's linked to the University of the West Indies. It will accommodate a kind of global network of health systems, because we are digitizing the records, so telemedicine and so on will be available. And so we're really moving the needle in a substantial way to creating a very modern hospital facility. And people are deserving of it. The fact is, when you look at the legacy of the past with underinvestment in public health, it would have taken the time and the resources to get us to that point, coming from where we were.
Mm-hmm. So obviously, patient satisfaction and the staff comfort is very much paramount on the mind of yourself and those involved in the works.
That's very critical. Ultimately, it's about the patients. Mm-hmm. We're going to have to work on the human resources component, the customer interface, because we get too often, issues arising from some of those challenges. But we believe that if you fix the environment, train the people, then you will see an enhancement in the productivity or the output, which will augur well for patient care. And that's the vision for that site, as it is for the health systems across Jamaica, because we're doing several other build-outs across the country. All
right, Minister Tufton, it's always a pleasure talking with you. Thanks for the information this morning, and we'll stay in touch.